Bleeding out, blood pressure crashing, 60 seconds until irreversible damage. One doctor grabs the airway, pushes fluid, and barks orders to the team. The other scrubs in, cuts through skin and muscle, and physically clamps a hemorrhaging artery with their hands. 2 careers, 1 trauma bay, only one question matters. Which doctor do you want to be? Dr. Jubal, MedSchoolInsiders.com. Emergency medicine doctors and trauma surgeons often stand side by side in the trauma bay, but their training, scope, lifestyle, and career trajectories couldn't be more different. Let's break it down. Emergency medicine physicians are the ultimate generalists of acute care. They treat everything from heart attacks to broken bones to psychiatric emergencies. Their job is to stabilize patients, make rapid diagnoses, and either treat or hand off to the appropriate specialist. Think of EM doctors as the hospital's first responders. They go an inch deep but a mile wide, knowing a little about everything so they can handle whatever comes through those doors. Many patients are treated and discharged without ever seeing a specialist, as EM physicians suture lacerations, reduce fractures, manage acute asthma, and treat infections from start to finish. Trauma surgeons are surgical specialists who operate on patients with life-threatening injuries. In major trauma cases, they lead the resuscitation from the moment the patient arrives in the trauma bay, a specially equipped area within the ED where the trauma team takes command. When a patient has a ruptured spleen or a penetrating chest wound, the trauma surgeon takes them to the operating room to repair the damage. Trauma surgery is a subspecialty of general surgery. These physicians complete a full general surgery residency before pursuing additional fellowship training in traumatology or surgical critical care. Beyond the operating room, they manage critically injured patients through their entire hospital course, from ICU care to recovery, adding an intellectual dimension that balances the intensity of the emergency room. EM doctors are expert diagnosticians and resuscitators for undifferentiated emergencies. Trauma surgeons are specialists who take ownership of the injured patient from resuscitation through surgical repair to recovery. Essentially, EM doctors stabilize and hand off, trauma surgeons take the scalpel and finish the job. The training pathways differ dramatically, starting with length. Emergency medicine residency is 3 to 4 years after medical school. It's one of the shorter residency tracks, which means you're earning an attending salary sooner. However, there's a push to make all EM programs 4 years. The ACGME has proposed mandatory 4-year training starting as soon as July 2027. We covered the implications of this change in a previous video right up here. Trauma surgery requires a much longer commitment. First, you'll complete a 5-year general surgery residency. Then you'll pursue a 1 to 2 year fellowship in trauma or surgical critical care. That's 2 to 4 years longer than EM's training time. These specialties also sit on opposite ends of the competitiveness spectrum. Let's look at the data from specialtyrank.com. First, match rates. Emergency medicine has a 98% match rate, which means if you apply, you're almost certainly matching somewhere. General surgery, the required pathway to trauma, has an 81.8% match rate. Nearly 1 in 5 applicants don't match. Next, research requirements. EM applicants average 5.7 research items. General surgery applicants average 10.9, nearly double. 5 extra research items might not sound like much, but during clinical rotations, board exams, and applications, doubling your research output is a massive lift. The bottom line is that emergency medicine ranks 20th out of 22 specialties in competitiveness. General surgery ranks 7th. To get a closer look at these specialties and more, check out specialtyrank.com, where you can see how each specialty stacks up and even customize the weighting of each factor based on what matters to you. Link below. As for compensation, emergency medicine physicians earn an average of $411,000 annually. Given that most EM doctors work around 40 hours per week in shift-based schedules, this translates to a solid hourly rate. Trauma surgeons earn approximately $491,000 per year, a difference of $80,000. But the trauma surgery lifestyle often demands significantly more hours, including overnight trauma call and lengthy operations that stretch well beyond scheduled shifts. But this is what most people miss. A trauma surgeon spends 3 to 5 additional years in training, earning a resident salary of roughly $70,000, while an EM physician is already making $411,000. That's over $1 million in lost earnings before you even factor in the longer work weeks. In terms of lifestyle, both specialties are intense, but the differences are substantial. Emergency medicine operates on a shift-based schedule. You clock in, work your 8 to 12 hour shift, and clock out. When you're off, off, you're truly off. No pager, no following up on patients, no taking work home. The trade-off, those shifts rotate between days, nights, and weekends, which wreaks havoc on your circadian rhythm. Missing holidays and family events is common, and when you're on shift, there's little downtime. EM is controlled chaos all the time. You're constantly cycling through patients and managing a dozen cases simultaneously. Emergency medicine has the highest burnout rate of any specialty at 63%. The combination of circadian rhythm disruption, constant high-stakes decisions, and dealing with non-emergent visits creates the perfect storm. Trauma surgery also operates on shifts for trauma call, but the rhythm is completely different. It's boredom punctuated by terror. There are genuine lulls, like waiting in the lounge, rounding on ICU patients, or catching up on notes. Then the radio crackles, gunshot wound 5 minutes out. The team assembles in the trauma bay, gowned and gloved, trauma shears ready. Everyone stands in position, waiting for the doors to burst open. When the patient arrives, clothes come off immediately and the choreographed resuscitation begins. When traumas roll in, the work doesn't stop until the patient is stabilized, which might mean multiple trips to the OR, hours of surgery, and intensive monitoring. A busy trauma shift can keep you working continuously for 12 to 24 hours managing multiple patients. And because trauma surgeons are the first surgical line of defense, the emotional weight of losing patients, who are often young, healthy people, compounds over time. The key distinction is that EM is controlled chaos all the time, trauma surgery is hurry up and wait, then everything happens at once. Before we move on to the pros and cons of each specialty, let us know in the comments which career battles you'd like to see next. We've also covered psychiatrist versus psychologist, neurologist versus neurosurgeon, and more in our career battles playlist linked in the description. Let's look at the pros and cons of becoming an emergency medicine physician. First, the pros. The variety of cases is unmatched. You'll see everything from heart attacks to psychiatric crises to pediatric emergencies, all in a single shift. No 2 days are alike. The schedule offers true time off. When your shift ends, you're done. No rounding, no callbacks, no administrative work following you home. Training is relatively short. After only 3 to 4 years, you'll be earning an attending salary faster than most specialists. Now, the cons. Burnout is a serious concern. At 63%, EM has the highest burnout rate in all of medicine. The constant intensity, irregular sleep, and dealing with non-emergent visits takes a toll. You rarely see the outcome. You stabilize patients and send them off, often not knowing whether they survived, recovered, or walked out of the hospital. Career longevity is also challenging. The physical demands of shift work, especially night shifts, become harder to sustain as you age. Now, the pros and cons of trauma surgery. First, the pros. You're the one who saves lives directly. When a patient is bleeding out, you're the person who opens the chest and stops it. The impact is immediate and tangible. The procedures are big and varied. Trauma surgeons perform everything from exploratory laparotomies to emergency thoracotomies, often on the same patient. ICU management adds intellectual depth. You're not just an operator. Managing critically ill patients in the ICU requires a different skill set that keeps the work intellectually stimulating. Now for the cons. The training is brutal. 5 years of general surgery residency plus a 1 to 2 year fellowship means up to 7 years before you're a fully trained trauma surgeon. It's the same length as neurosurgery and one of the longest paths in medicine. The emotional toll is also significant. You'll lose patients, sometimes young, healthy people whose lives were cut short by accidents or violence. Delivering that news to families becomes a regular part of the job. Plus, the unpredictability never ends. Even as an attending, you're at the mercy of when traumas arrive. A quiet evening can turn into an all-night marathon without warning. So, which path is best for you? Choose emergency medicine if you thrive in fast-paced environments, want variety in your daily work, and value true time off when you're not on shift. Be honest with yourself about the risk of burnout. Choose trauma surgery if you want to be the person who definitively fixes the problem. You'll need the stamina for a long training path and the emotional resilience to handle losing patients despite your best efforts. EM doctors are the quarterbacks of the trauma bay, calling plays and coordinating the team. Trauma surgeons are the closers, stepping in when it's time to operate. Both save lives, both demand excellence. The question is which role fits who you are. For a deeper dive into each specialty, check out So You Want to Be an Emergency Medicine Doctor and So You Want to Be a Trauma Surgeon right up here.